Although St. Lucia has not received confirmation of the presence of the Omicron variant on island, the unprecedented increase in confirmed cases of COVID-19 suggests that it is present.
Health officials believe that Omicron is in circulation on the island, causing an escalation in new positive diagnoses, with the combination of the Delta variant in the escalation of the fifth wave of the pandemic. The daily total of confirmed positive cases over the past few days have hovered at the mid-400 mark.
Our daily infection rate has risen from 98.5 to 166.3 per 100,000 cases over a 7-day period, and our RT has been calculated at 3.3, which is the highest since the commencement of this pandemic.
National epidemiologist Dr. Michelle Fassois says, given new and emerging data on the characteristics of the SARS-CoV-2 virus, the Ministry of Health has taken the decision to adjust the isolation and quarantine periods for confirmed cases and close contacts of cases, respectively.
Effective Monday, January 24, 2022, for persons who are considered close contacts of a confirmed case of COVID-19 and do not have any symptoms of COVID-19, the quarantine period may be terminated after receiving a negative result, which should be taken on day 7 after the last contact with the confirmed case of COVID-19. If the test was done before the 7th day after the last contact with the confirmed case of COVID-19 and is a negative result, that result may be a false negative and the individual is required to get tested again on day 7. If symptoms develop during the quarantine period, the individual is advised to get another test.
The isolation and quarantine timeframes for the fully vaccinated have also been adjusted.
Individuals who are fully vaccinated and test positive for COVID-19 but have no symptoms may end the isolation period after 7 days. If, however, symptoms develop after testing positive, the isolation period must be restarted, with day 0 being the first day of symptoms and terminated on completion of day 10.
And what of the unvaccinated?
For unvaccinated persons who test positive for COVID-19 and are asymptomatic, the isolation period remains 10 days from the date of the sample which led to the confirmation of COVID-19. If symptoms develop after testing positive, the isolation period should start over. Day 0 is the first day of symptoms, and the 10 days of isolation must be restarted. Finally, for all persons who test positive for COVID-19 and have symptoms, regardless of their vaccination status, a 10-day isolation period must be completed. The individual must also be asymptomatic for 3 consecutive days, meaning days 8, 9, and 10, in order to be discharged from isolation.
Despite the Omicron variant believed to be less severe, it still poses a threat with a high transmission rate that has placed the healthcare system under immense pressure as more people get tested and seek out medical care. Health officials continue to appeal to the public to adhere to protocols to break transmission of the virus. These include regular hand washing with soap and water, use of alcohol-based hand sanitizer if soap and water is unavailable, proper use of face masks, cleaning and disinfecting frequently touched surfaces, and maintaining physical distance. Solange Alfred, HTS News Force.